and we were looking at the breakthrough limitation prompt for our proposal. And the prompt basically asked how we would lower mortality rates for a COVID variant that's less deadly, but with a high percentage of asymptomatic patients. And to do this, we looked at 3 different goals. One of them was to detect transmission among asymptomatic people. And to do this, we wanted to incentivize people to get tested frequently enough that it would be effective to detect the population that is infected. And we also needed to set up testing sites in like convenient locations so that enough people could access the test. The prompt also said that we should operate under realistic assumptions. And so we interpreted this as we would have funding from the government, but obviously not unlimited funds. We also said that there would be a resistance to a vaccine passport type idea. And we also assumed that asymptomatic people would quarantine for the health and safety of others. And the goal of the prompt was to decrease mortality. And we said we would do this by increasing testing so that people who are asymptomatic will be able to effectively quarantine to prevent the spread. We also looked at Georgia as a test case just because the breakdown of the rural and urban population and also the conservative and more liberal population was reflective of like the greater United States.
For the implementation of our containment plan, we have 2 main driving forces. The first one being the tracking and the second one being the incentive. Our tracking plan revolves around the development of an application that can be used to notify the user of the status of their test and when it will become overdue. Here's a graphical representation of how the application will work. Green means your test has come back negative. Yellow means you need to go get tested. And red means your test has come back positive and you are required to self-quarantine. On top of this, the app will have an anonymous proximity tracker that informs the user whether they've been in contact with a person contracted with COVID-19. The incentive of testing comes from looking at how many times a person has been tested relative to the 36 10-day testing cycles throughout the year. For example, if a tax filer goes to all 36 testing cycles in a year, they'll have 5% of their income exempt from taxes. However, if they only go to half of these testing cycles, their tax exemption rate is cut in half.
Okay, so this map shows the population density of Georgia. And if you look, the more urban areas, it's located in the upper central part of it. And if you compare that to the case count map, most of the cases are centralized in the urban areas. So going off of that assumption, we assume that for rural areas, because there's a lower population density, there will be less cases. So to accommodate that, we will mostly have either a centralized testing location using rural health clinics with bi-weekly mobile testing sites on weekends for easier access. We will be using the same smartphone application, but for those without one, we will be providing rudimentary smartwatches that just show a color change for the testing status. The pandemic has really highlighted like the distrust with local communities and the federal government. So we'll be focusing on community outreach by collaborating with local elected officials, healthcare workers, and faith leaders to really promote increased testing. And we will be monitoring hospital capacity. So once the bed capacity has reached a certain percentage, we will switch to weekly mobile testing sites to encourage further testing.
Okay, so we also didn't want to be passive towards any potential problems with our policy. So it is important to note that funding and costs are definite constraints to carrying out the means in which this policy follows, because there's no certainty how much the government or another sponsor would be willing to fund. It's also difficult to ensure that if a patient is notified that they tested positive, that they will quarantine as soon as possible. So this will always leave the uncertainty of how effective this means will be, because social distancing is more a localized issue. And so it's not free of flaws because of the inconstant behavior of asymptomatic cases and the unreliable compliance levels of the population as a whole. Thank you so much.
Thank you, teammate. Great presentation. We'll throw it over to our judges for questions.